And joining me now to speak about this is a consultant cardiologist, Dr. Abiodun Olugbenga. Good to have you join us, Dr. Olugbenga.
A warm afternoon to you, and thank you for having me.
Right, so more than 18 million people die from heart-related diseases every year. And it is not just this figure, because these are people, this is not just numbers, but it is demographics that also make up this figure that is quite alarming, because young people also now die from heart-related diseases. It used to be a thing of, older persons and then maybe weight-related issues. So talk to us about this, and then some of the practices that would cause this kind of situation, especially for young persons.
Okay, thank you for your question. As you introduced in your opening, we know that cardiovascular disease is the #1 killer all over the world, killing over 18 million people globally. To bring it home to Nigeria, it kills over 200,000 people every year. And some of the risk factors that cause cardiovascular disease are particularly common in young people, and they include smoking, for example, use of tobacco and tobacco products. It's a potent risk factor for cardiovascular disease, not only for cardiovascular disease, even for cancers. Also, we should not forget about the use of harmful alcohol use. And so also is the use of unhealthy diets and increased intake of salt. And of course, these days, because of these risk factors, like also a reduction in physical activity, a lot of people do not exercise these days. These with some cardiovascular diseases like hypertension, diabetes, and elevated cholesterol are things responsible for increased number of cases of cardiovascular disease.
And the thing with cardiovascular disease is that it is quite underreported, and most people who have it do not know, or they are not aware until catastrophe occurs. So is there a way to detect that one has cardiovascular disease just before it becomes a catastrophe?
You are very right about that observation. One of the leading causes of, leading risk factors for cardiovascular disease is hypertension. And you should not forget that hypertension is a silent killer. So oftentimes, this is asymptomatic, that is, patients do not have symptoms, and only for them to present to their doctors when they have complications already. So some of the things we can do to prevent the development of cardiovascular disease include taking our heart seriously, measuring our blood pressure regularly, seeking health care regularly, and also adopting healthy lifestyle choices. For example, regular physical exercise, about 150 minutes per week of moderate intensity exercises, stopping smoking, also moderating the use of alcohol to occasionally, and increasing and reducing salt intake. So these are some of the things that can help us in addition to ensuring that if we have hypertension, elevated cholesterol, or diabetes mellitus, that we follow our doctor's instructions carefully. So if we do this, as well as also present to our doctors at the slightest hint of trouble, because at times, for some people, they may be fortunate to have some symptoms, before catastrophe comes in. So if we are able to do all of this, we'll stand a great stead to prevent the development of cardiovascular disease.
And we also understand, because there's a report within the health sector, that only about 1/3 of those who are affected by heart diseases are on effective treatment. Why is that? And is there a way to get more people aware of this situation and then get them on treatment?
Excellent. I think this starts with creating awareness, and that's why we are celebrating the World Art Day today, which is themed using our arts to connect with others. For example, our friends, our relations, our co-workers or neighbors, fellow religious members, because there are some people who do not have the resources and the tools to have access to information that will help them live in a healthy way. Okay, so it is incumbent on all of us to share the news, to increase the awareness, so that people all over the world, and particularly in Nigeria, can take heed to the common causes and common risk factors for cardiovascular disease, so as to prevent them.
So basically, we all have to do better in how we care for ourselves and our hearts. Thank you so much for talking to us, consultant cardiologist, Dr. Abiodun Olugbenga.
Thank you for having me.